I define integrity to my students as having a higher standard for yourself and for others around you. How I hope to achieve integrity and to nurture that in my students is if they tell me something, that they follow through on it, or if they're given tasks, that they follow through on the tasks without making any excuses and holding themselves liable for their actions. Some of the positives that can be a direct result of responsible behavior is that the student will walk away with a sense of accomplishment, a sense of that they were able to do something correctly and that they now know what to do if they're ever presented with that similar situation out in the professional setting.
Integrity is important because you come to the same place where you work every day and you try to help patients, and at the end of the day when you leave and somebody says thank you so much for what you did for me, and even patients sometimes bring in cookies and they bring in goodies for us, and it just shows that we're doing our job and we're helping somebody out. Medical assistants bring the patients in, they do vitals on the patients, EKGs, blood work, we do chest x-rays. Your cholesterol was 145, which is very good. I do a lot of calls on the phone, answering patients' questions, calling with results, doing refills for patients, and of course anything that doctors need, they ask me and I do for them. Getting results from other places, other doctors, faxing results, just a lot of multitasking.
Integrity to me in the medical field is somebody that comes to work who takes their job very seriously, who understands that this is human lives that we're dealing with, understands the compassion, the respect, and the honor that you must give a patient, and the fact that this is classified information that is not to be discussed with anybody else. What I look for in an employee that shows integrity is somebody who really cares, who's somebody who really truly wants to be there, not because we get paid on Friday, but because they really care about the patients and the care that they're getting, and they're happy to see the patient. They know about the patient. Hey, how's your grandkid doing? You know, how you been since you got out of the hospital? You know, somebody that really takes the time to care.
When I think about the level of responsibility that medical personnel have, I think that there is a misconception that the doctor and perhaps the nurse as well, but certainly the doctor or the surgeon has a very high level of responsibility, and then the responsibility decreases as you go down through nurses, medical assistants, someone working at the desk, someone who's in billing and coding, someone who's taking blood pressure. I completely disagree. All of these people have an equal level of responsibility for me. There are just different ways that that responsibility is put into practice. So, for example, if I'm going in for one of my chemo treatments, every time before a chemo treatment, you have blood work so that they can determine, can you handle the chemo that week? Are your white blood cells high enough? Because if they're not, it can be very dangerous. So that person who's taking my blood, if they make a mistake somehow, or the person who reads the results, if there's a mistake made there somehow, someone misuses the machinery, that can be life-threatening for me. That responsibility is enormous.